my dear students. I'm Dr. Vaishali Bharambi. I've been teaching anatomy for a long time and I love it. What are we going to learn today? Today we are here to discuss the submandibular region and the submandibular salivary gland, part 1, which means there's a part 2 coming. Okay. So before that, let's try to understand where we are. Okay. In this topic, how much do we really understand? The question asked in one MCQ is, patient has come with a suspected submandibular salivary gland enlargement. You would be able to palpate it intraorally, extraorally, intraorally as well as extraorally, or such an enlargement is detectable only on radiographical examination. Now this needs you to ponder on every option given. Okay? Or else sometimes they may ask you anatomy of submandibular salivary gland and a note on submandibular ganglia. You really can't, just answer these questions on some general knowledge. You really need to know. So let's try to get and know that in the next 20 minutes. So what is submandibular region? What does it contain? It's a region which is bound above by the mandible, below by the hyoid bone. It contains a lot of muscles, nerves, submandibular ganglion, arteries, and some salivary glands. Which salivary glands? Submandibular and sublingual salivary glands. Okay. So what we are going to do is, we are going to discuss this topic as under muscles, nerves, arteries, salivary glands, and finally submandibular ganglion, which will be done in the next lecture. So what muscles do we get? Students, just pause for a minute and understand that as you enter into the submandibular region, you find that the muscles are organized in form of layers. There'll be one layer, and then deep to that another layer, and then deep to that another layer. Okay, I'll show you how to understand this. The first lot of muscles you will see are all called as suprahyoid muscles. Suprahyoid, above the hyoid. That means these are muscles that suspend your hyoid bone from your skull. Which are these muscles? Let's take a look. This is the anterior and posterior belly of digastric. Anterior belly coming from your digastric fossa in your mandible to the hyoid bone. Posterior belly coming from digastric notch in your mastoid coming down. Both are forming, as you can see, an intermediate tendon which is held down to the hyoid bone. So, first muscle we learnt is anterior and posterior belly of digastric. Now we get the next one, stylohyoid. You do recall that posterior belly of digastric and stylohyoid are great friends? Okay, they're always together. In fact, posterior belly is said to be a displaced, separated part of the stylohyoid muscle itself. Okay. One more muscle you are seeing here is the mylohyoid. Mylohyoid comes from both sides of your mandible medially. The fibers fusing with each other and partly attached to the hyoid bone, forming this floor of your mouth or the gutter into which your tongue quietly comes and sits. Okay, so that's the mylohyoid. And if you look carefully through the mylohyoid, you're able to see a muscle, the geniohyoid, going from the inferior genial tubercles to your hyoid bone. You saw that each muscle is attached above to the skull and below to the hyoid bone, holding the hyoid to the skull. What are the 4 muscles you learnt now? Anterior posterior bellies of digastric, stylohyoid, mylohyoid, and geniohyoid. Okay, right. So now, were you to remove these muscles, you would come to the next layer of muscles. What is the next layer of muscles? These are extrinsic muscles of the tongue. I have not mentioned the palatoglossus in this diagram because it is not coming in this region. But the muscles that you should see are 1, coming from styloid process to your tongue. Can you name the muscle? Yes, it's the styloglossus. Coming from hyoid bone to the tongue, hypoglossus. Coming from genial tubercle to the tongue, genioglossus. Isn't that easy? I find it very sweet. Okay. So anyway, so these are the muscles. Take a look now. From styloid process to the tongue, styloglossus. From hyoid process or hyoid bone to the tongue, hyoglossus. From genial tubercle to the tongue, genioglossus. That's the next layer that you will find. Were you to go behind posteriorly at a deeper level, you get these other muscles I told you about. Basically, they're all muscles which are contributing to your pharynx in some way or the other. For example, from styloid process to the pharynx, stylopharyngeus. Behind that, superior constrictor. Below that, middle constrictor. So the three muscles you are seeing, stylopharyngeus, superior constrictor, middle constrictor. These are all the muscles you see in the submandibular region. If there are muscles, there have to be nerves. Perfect. So, accompanying my stylopharyngeus is its best friend. There are a lot of friendships happening here. Who is always with stylopharyngeus? The glossopharyngeal nerve or the nerve of third arch. Okay, supplying it, as you can see here, and continuing forward to the tongue to supply the posterior 1/3 of tongue. Come further down, you come to the 12th cranial nerve or the hypoglossal nerve, which is traveling forward, as you can see, passing over the loop of lingual. Okay, and then the two are separated by the hyoglossus muscle, one going superficially and the other going deep. Also present from the top forming a loop is your lingual nerve, from which is suspended the submandibular ganglion, and it finally goes and supplies the anterior 2/3 of tongue. So the nerves you saw were three: glossopharyngeal, hypoglossal, and lingual. Finally, what are the submandibular glands in this region, which is the topic for the day? Okay, so what you're seeing here now are several, see the yellow ones, several salivary glands, one of which is the submandibular salivary gland, which is divided into superficial and deep part, and then there is one anteriorly just below your tongue, the sublingual gland. So how many salivary glands? Submandibular and sublingual. Right. So now we come to studying the anatomy of submandibular salivary gland. Where is the submandibular salivary gland? It is present just below the lower border of posterior half of mandible. See, this is the mandible. Go to the posterior half, just below that is your submandibular gland. What does it look like? Can you tell me what it looks like? Yes, it looks like a walnut. Okay. And these are fun facts that just makes anatomy interesting. That's all. It weighs about 10 to 20 gram and is classified as a mixed serous and mucus type of gland. Right. So now take a look at this image and you can see that this is the gland. Okay. It's a gland that is bent in this manner. Around what is it curving? Around the posterior border of your mylohyoid muscle. So here's your mylohyoid muscle and the gland is winding around the mylohyoid muscle. Larger part of the gland is superficial, deeper part of the gland is small. Okay, the smaller part of the gland is deep. Okay, so this is the superficial part of the gland. This is the deep part of the gland. And in the middle is your mylohyoid muscle. Right. So now we are going to concentrate on the superficial part of the gland. You can see that this is a section of the superficial part of the gland. You can see how it is enclosed within the investing layer of deep cervical fascia. Okay. The deep cervical, this was taken with you earlier if you have attended the earlier lecture on deep cervical fascia. The investing layer rises up. And as it reaches the superficial part of submandibular gland, it splits to enclose it, attaching itself to the mandible. Okay. So superficial part of the gland enclosed within investing layer of deep cervical fascia. The superficial part of the gland has an anterior end and a posterior end. Okay. It has three surfaces. A medial surface related to all those structures I taught you earlier. A lateral surface related to mandible and a superficial surface or inferior surface related to skin and structures in between. So these are the parts of submandibular salivary gland. Let's study each of them individually. So we'll study anterior and posterior and we'll study the surfaces and so on. Okay? Let's discuss them. Before that, ask yourself, what have I understood? Okay? Have you understood that you're going to see muscles in layers? muscles of the suprahyoid muscles, the muscles of tongue, and then you saw a few muscles of pharynx. You saw a lot of nerves. Which were the three nerves you saw? Glossopharyngeal, hypoglossal, lingual. You also saw the loop of the lingual artery, isn't it? So these are structures which I find in my submandibular region, along with what? Along with two salivary glands, a submandibular salivary gland and a sublingual salivary gland. Then we understood how the submandibular gland winds around the mylohyoid, okay, so that it has a superficial part which is larger and a deep part which is smaller lying on the inside. We'll now study the superficial part. As you can see here in the image, the superficial part has an anterior end and a posterior end. The anterior end is related to the anterior belly of digastric right up till here, okay? And the posterior end is related to what is called as the stylomandibular ligament. Now, if you've studied the deep cervical fascia, you might know this, otherwise you won't. But you will if you take a look at this image now. Can you see that there is a ligament passing from your styloid process to the mandible? This is called stylomandibular ligament. It separates the submandibular gland here with the parotid gland here. Okay, so that ligament separates the submandibular from the parotid gland. Right. With this, we come to the surfaces. We've done the anterior end, we've done the posterior end. While studying the surfaces, let's talk about the inferior surface first. So here you are seeing the submandibular gland. This is the inferior surface. See the line that will show you the exact inferior surface. It is separated from the skin by a number of structures which include superficial fascia. Can you tell me what is the dotted line there? Can you tell? Which muscle would it be? Yes, it's the platysma. Okay, good. Now you're seeing the facial vein which is lying deep to platysma along with the cervical branch of facial nerve. What you also see is the investing layer of deep cervical fascia and a whole lot of submandibular lymph nodes, 3, 4. But you see that the lymph nodes are lying deep to the investing layer of deep cervical fascia. In fact, sometimes the lymph nodes might be lying inside the gland itself. This is of clinical relevance when you're trying to remove the lymph nodes because of some malignancy. You might have to remove the gland itself because the lymph nodes are embedded in the gland. Right. That's the applied anatomy you should remember. So this completes our inferior surface. From the gland to the surface, to the skin, superficial fascia, platysma, facial vein along with cervical branch of facial nerve, investing layer of deep cervical fascia and submandibular lymph nodes. Right. So this is a little bit about the submandibular lymph nodes. These are the submandibular lymph nodes. As you can see, they have a huge area of drainage. Okay. Please follow these dotted lines to give you an idea of what all they drain. Okay. The entire zone here is drained into the submandibular lymph nodes, increasing the chances of their becoming thickened, infected, inflamed in response to any infection in this region. Right. We now come to the lateral surface. As you can see, the lateral surface is related to the mandible, the mandibular fossa to be precise. Okay. Also present here, close to the angle of mandible is which muscle which helps you to chew? Yes, it's the medial pterygoid muscle. Now, this region has got a special relationship with your facial artery. As you can see, it winds around the posterior end of submandibular gland, initially lying medial to it, see here, and then winding around to lie between the gland and the mandible, finally winding around the lower border of mandible to come on the surface. Okay, now this is easier to imagine or easier to see than for me to teach you. Let's take a look to understand that it winds around the gland, winds around the lower border of mandible to appear on the surface. If you clench your jaw, do it. You will feel your masseter. Just go anterior to the masseter. You will feel the beautiful pulsations of this facial artery against the mandible as it is passing upwards to supply your face. Please do it, students. Don't just listen to me because I am here to teach you. These are interesting facts of life which make anatomy very real to you. And that's what it is. You're learning to understand on a real person, not only on the catalogue. I hope you got it right. So that's the kind of S-shaped loop that the facial artery makes. With this, we come to the medial surface. That means what lies deep to my superficial part of my submandibular gland. So this is a very extensive surface. Okay. So what they've done is we've divided the surface into anterior medial relations, intermediate medial relations, and posterior medial relations. Again, better to see than for you to listen to me talking. Here's your superficial part of salivary gland. See, it's marked out in red line. Medially, it's related in the anterior part to mylohyoid muscle. Running over it is the submental artery and mylohyoid nerves and vessels. Question, what is mylohyoid nerve a branch of? Inferior alveolar nerve. Okay, good. Now come a little back, little posteriorly. In the intermediate area, you see a number of relations. If you have been listening to the earlier part of the class, you already know how to name them. Lingual nerve. If there is lingual, what is suspended from it? Perfect, the submandibular gland. Come further below which muscle? Hypoglossal. Goes from where to where? Hyoid bone to the tongue. Now you see the loop of lingual artery and you see running over it forward your hypoglossal nerve. Who is accompanying hypoglossal nerve? The venae comitans always accompany the hypoglossal nerve. You can see the pretty blue colored veins there. That's the venae comitans. So these are all the intermediate relations of superficial part of salivary gland. Come further posteriorly now, you find styloglossus. Structures coming from the styloid process, styloglossus, stylopharyngeus. Which nerve? Obviously glossopharyngeal. Posterior belly of digastric and the middle constrictor. These are all more posterior relations of superficial part of submandibular gland. Okay. So let's stop here and let's see if you really understood. Because there's a lot of stuff coming your way. Check yourself whether you've understood. So, can you label this? Yes, it's the mylohyoid. This one, anterior belly of digastric. This one, from styloid process to the tongue, styloglossus. Very nice. From styloid process to the pharynx, stylopharyngeus. From hyoid bone to my tongue, hypoglossus. From digastric notch to hyoid bone, posterior belly of digastric. And this one is obviously the middle constrictor. So, these are the muscles you see. Let's try again. Let's see if you're able to recognize the structures here. What is this? Lingual nerve. Immediately you should ask yourself, accompanied by, suspended from, is your submandibular salivary gland, submandibular ganglion. Right. Now what is this one? Glossopharyngeal. This one, hypoglossal nerve. This is the mylohyoid nerve and vessels. That's it. Let's see if you remember the names of blood vessels. This one is lingual artery. These are the small blue ones, venae comitans accompanying my hypoglossal nerve, submental artery, mylohyoid artery. Okay. So you are in your mind now sort of prepared that these are the players of this region. Okay. That's how not only you study the gland, you also study the region. This submandibular region is not only about the gland, it's about everybody who lives there. Every muscle, every artery, every nerve. So you have to study the region as a whole. Correct. So we come to the deep part of the gland. Superficial is done. We now come to the deep. This is your deep part. Okay. So now tell me how would you describe the deep part? Yeah. Above bound by lingual nerve, below bound by hypoglossal nerve, laterally bound by mylohyoid, medially bound by hypoglossus. Let's see. Yes, it lies on the hypoglossus, superiorly related to lingual nerve and submandibular ganglion, inferiorly related to the hypoglossal nerve. 4 directions of relations of this gland are fixed. From its apex, you can see emerging here the Wharton's duct. We'll discuss that. Let's now come to revision. Okay. So here, Let's revise. We know that submandibular salivary gland is divided into superficial and deep, larger superficial, smaller deep. The superficial part has got an anterior end and a posterior end. Anteriorly till the anterior belly of digastric, posterior till which ligament? Stylomandibular ligament. Very nice. Then we took a section through the superficial part and we saw that it's medially related to all those muscles, nerves and arteries I spoke about. Laterally related to the mandibular fossa, separated from it for a short while by the facial artery. And then superficially or inferiorly, it's related to all structures from the gland to the skin. That means skin, superficial, fascia, platysma, facial vein, accompanied by cervical branch of facial nerve, and investing layer of deep cervical fascia and submandibular lymph nodes. This must come to you after a point of time as default. Okay, you shouldn't have to keep thinking every time. Right. Then we talked about the deep part, which was bound laterally by mylohyoid, medially by hypoglossal, superiorly by lingual nerve and submandibular ganglion, inferiorly by hypoglossal nerve, accompanied by venae comitans. Okay, so that kind of completes the basic anatomy of submandibular gland, its superficial part as well as deep part. But what I am seeing here is something is emerging from the deep part of the gland. That is my Wharton's duct or the submandibular duct. Okay, more about this will be discussed in my lecture 2. Let's now revise what we have learned. What we have done is we have built a foundation. Now we are going to, in my next lecture, we're going to talk about how this gland functions and what is the anatomy you should know to understand its functionings as well as the applied anatomy. So, today what we understood is that this gland is related to a number of structures deep to it. These structures are divided into muscles, nerves, blood vessels and so on. The muscles were put in form of 3 layers, suprahyoid muscles, muscles of tongue and muscles of pharynx. Then we talked about a lot of nerves. Which were the nerves? Glossopharyngeal, hypoglossal, lingual. One ganglion, submandibular ganglion, suspended from which nerve? Lingual nerve. Then we talked about how the submandibular gland is divided into superficial and deep, and we discussed the anatomy of both these superficial as well as deep part of the gland. With this knowledge, can I solve these MCQs? Let's take a look. A patient comes, the same MCQ. A patient comes with a suspected enlargement of submandibular salivary gland. You would be able to palpate it intraorally? Yes, because the deep part of my gland is lying within the oral gutter. Extraorally, yes, I can feel it now also because the superficial part of the gland lies outside. Intraorally as well as extraorally, I think that is the right option. That sounds logical. Such an enlargement is detectable only on radiographical examination. No, it's a large gland which is very much palpable. So, I think C is the right option. Okay, so sometimes you have to really study the MCQ to come to the most correct option. Right? Now, this one depends on purely your memory. Glands of Blandon and Noon are, what are these glands? Are they sublingual salivary gland? Are they palatine? Are they submandibular? Or are they anterior lingual glands located at the apex of the tongue, which is the right option? Okay, so sometimes knowledge helps, sometimes just studying helps. Okay, right. So now what I suggest is that you've done this lecture. You can go on my website. You'll get a lot more MCQs, which will keep testing you. Okay, and gives you an idea where you are, where MCQ solving is concerned. I want you all to attend Submandibular Gland 2 because that gives you very important functional aspects of the gland besides teaching a lot about anatomy as well. Okay, so my advice to you students today is whatever you are, be a good one. Short and sweet. Okay, whatever you're doing, whether you're studying hard, whether you're a good player, whatever it is you're doing, just be good at it. Okay. All right. Thank you so much. I enjoyed taking this class. I hope you enjoyed it too. If you have any problems, always feel free, put it in the comments section. Those of you who are regularly attending my classes probably know that my way of communicating with you is through your comments. So I'm very meticulous in following up your comments and responding to them whenever I get time. That's priority with me. Okay? So thank you, students. See you in my next lecture.